So I got a question for Paul and John, and for people who are maybe new to the journey and new to getting on board with the LAL, and obviously you guys struck gold. You got two awesome ODs that work for you clearly.
That's
So,
we are lucky.
so how do you
You
find?
can say so yourself, yeah.
Oh, is that me? Oh, you're right. It is me. Should I didn't even notice that. Wow. Uh,
Well said.
so how do you find the right team to work with? How does that work? Any advice at all?
Well, I think it's for I'll back up. I think specifically finding an OD specifically for light adjustable lens is different than I think just how do you find a good OD who you want to work with and who want to join your practice or really collaborate with. I think you really got to have you got to have a good communication pathway. Number one, you have to also have a really good rapport. I mean, you really got to trust each other. You got to involve each other. You got to trust, and I think that's probably the biggest thing that I've noticed. With Jeff is really when he came into this practice, he was very medically oriented. And one of the things we love about Jeff is he just wanted to learn. I mean, it was the best part of it for me was like, God, this guy is like, I felt like it was like I always wanted a fellowship, right? And I was like, this guy's like a fellow Macmini, not anymore. He teaches me stuff half the time. But it was just great to see this kind of mind that just says, I want to be a sponge. I want to understand. I want to learn. And that collaborative atmosphere is just because we both wanted to learn from each other. And it really, truly was that. So for me, I think those are the key factors. You want someone who just wants to learn, wants to grow, wants to never be complacent. My dad told me that many years ago. One of the phrases I always used from my father, who was an ophthalmologist, and he passed away back in 2019, was, Paul, never be complacent. Always, think about what can we do better? And that mentality, I think, is something that you really want to have with any person who's joining a practice or you're working with, especially in the context of something like LAL. So I think that's the bottom line. You can teach. It's not that hard. I think we think that we have to have someone who's super smart and super intelligent and on board scores and this and that. To me, it's all about personality, and it's about your quest and your drive to do better, for your patients, for your practice, for yourself, and to learn. That's, for me, has been the bottom line. And of course, Jeff exemplifies all that. And we've been lucky, no doubt.
Thank you, Paul. Yeah, I don't even know that I can add much to that, Paul. It's exactly right. You're looking for someone who wants to learn, someone who wants to continue to be part of cutting edge technology, and someone who is comfortable from a procedural standpoint. Because at the end of the day, the light adjustments you can think of it as a procedure because it is, and who wants to be involved in patient care at a level that is meaningful. And so some of it is quite frankly just on the interview. If you're looking for someone to join as an associate, it's like, well, what do you want to do? What are you looking for? What are the things that you find personally fulfilling? And how do you want to be a part of this team? How do you see yourself interacting? And I think the self-selection occurs where there are individuals who, so clearly want that as part of their journey in their profession. And they don't want to leave just a trail of individuals wearing contact lenses or glasses. They would like to treat individuals who have conditions that are treatable, who can optimize quality of life, who can be a part of their life journey in terms of a way that makes things better. It's so fulfilling but again, those are individuals who kind of self-select. So where do you find them? I think it's really just a matter of they kind of find you, in all honesty.
Yeah.
Word of mouth helps.
Yeah, it
Hey,
does.
Nick, you got any good optometrists anywhere?
Yeah, this is like part
Any
of
good
this
friends?
collective,
Yeah.
this hive mind here. I don't think you can just stick anybody into this role and expect it to work well. I don't. And I've talked to clinics who are, struggling with the technology, and most of the time it's because they've got somebody doing the adjustments who just doesn't have a passion for it. It's not hard, but you do have to have an elevated level of understanding of optics and the visual system. Higher order aberrations is a big part of this. And you do have to have an understanding of that, but really when you boil it down, it's not that hard. The procedure itself is really easy. You're just pushing a button and holding the lens. It's just like saying that painting a picture is not hard. My 4-year-old can paint a picture. But painting a picture, there's different levels of aptitude with what painting a picture is, and painting a good picture versus painting a picture that looks like it was drawn by my very talented 4-year-old. Two different things. So you have to have an understanding and you have to have a motivation, because the other half of this whole process, I think, Jeff, from our point of view specifically, it's psychology. Some of these patients, they come in and they do have a sense of entitlement because they paid top dollar for this, and you want to make sure they get the outcome that they deserve and that they paid for. But there is a psychological aspect to this where it's like if you give a mouse a cookie. I think I say that all the time. If you give a mouse a cookie, they're going to ask for a glass of milk. Then they're going to ask for a bedtime story. And then how much is too much? The definition of perfect is highly subjective. Everybody's definition of perfect is better, but patients come in, I want perfect vision. Well, what does that mean? Perfect is 20/20. But to the patient who paid $10,000, 20/20 maybe isn't good enough. So I
Yeah.
think the psychology of this is really what separates the good from the great, and the ability to have that personality and that personal connection to the patient, and then also building the rapport with the team, the surgeon, the staff. I think that's all a part of it.
Well, I
So
think that's, you hit it on the head in the sense that sure, there's a technical aspect to this in terms of the procedural but yeah, I mean, we all were trained on optics. We all can use a gonio prism. We all can, figure out how to get a good refraction there. That's not hard. What I think a lot of us miss, we think of ourselves as doctors, but yeah, and we are, but we're in the business of people here. We're in the business of building relationships. We're in the business of, trust and earning that trust and selling that trust. You're not selling a product half the time. I mean, it's not even just with the light adjustable lens. It's with a treatment plan that I've decided, that I think is valuable, and you got to get that patient's buy-in, because even if they feel like it's not the right treatment, or they're not 100% confident with you, they're either not going to comply with that treatment, or they're going to go somewhere else for a second opinion, right? So the biggest skill you can have is not what you learned out of school, but rather, your people skills and your social ability and your ability to, talk to people and comfort people. And if you're spending a lot of time with those patients, that's a good thing in that sense, because you're building relationships there. And yeah, there will be times where I do spend a lot of times with patients simply because I'm getting to know them, and because I'm dealing with the psychology. What are your expectations, and how do we get there? And what do you want to do? What do you like to do? All that kind of stuff is really a part of the job too. And if you're not interested in that, then the reality is you're not in the right business. At the end of the day, you're going to hate what you do. So, in terms of, for those MDs looking for ODs with this, yeah, I mean, you got to find an OD that wants to do this. You got to be motivated to this. You got to be willing to learn. I mean, Paul will tell you, Paul initiated, the conversation in the beginning where he was saying, like, he wanted to learn and he wanted to do it. And he had every right to do that. But I was a nagging person in his ear, like, when is my time? When is my time? When is my time? Like, I want to do this. I got my buddy Nick up there telling me all about how great and how awesome it is. Like, when can I, hang out with him and do that kind of stuff too? So that's just me. I mean, if there's any of my classmates on watching tonight, or even my professors, they'll tell you there was nothing special about me academically, especially in school and definitely coming out of school. What made me strong and what built the relationship with Paul is ultimately my desire to master my craft. I don't really care what accolades I get. I don't really care, what comes my way financially. I don't care what people think about me ultimately, but I want to be able to tell myself, look in my mirror and go, I did the best that I could possibly do for the patients that I was seeing. It wasn't just seeing patients and collecting a paycheck. It was just mastering my craft. So, getting that opportunity to work with Paul, I didn't know anything about Paul. I didn't know how well renowned he was, in the industry and things like that. I didn't have any motivations. I just wanted to learn, and I wanted somebody to teach me and, put my feet to the fire in situations that I was uncomfortable with. And that's what the light adjustable lens can do for you. It can take you into that next step in terms of, you're not just doing refractions, you're not just doing, gonio lenses. You can kind of put all this together. You can do the procedure. You can then, get great outcomes for patients, and you can feel extremely rewarded at the end of the day and be a part of that, and be a part of a successful practice that does that for patients. So you don't have to be anything special. You just have to, love what you do ultimately and want to do it.
You raised so many good points, Jeff. I would maybe add just a little bit of additional color, in as much as anyone who is really good at something makes it look easy. And they'll tell you it's not hard. Well, the reality is, once you're really good at it, it's not hard. So there is a learning curve, and there is certainly an amount of dedication, like you said, to I'm going to be the person who's the master of this. I am going to be really good at it. And so the reality is, the techniques and the subtleties and the things that make you really good at it make it look easy. But the reality is that there's a little bit of a learning curve for sure, but there's a lot to master the skill set, and not that different from so many other procedures and things that we do. You can become very good at it and make it look easy. But at the end of the day, it is that dedication and that desire to be the best you can be. That's really what sets you guys apart.